People sometimes say psychiatry is a weak specialty because we don't cure disease. This sounds convincing until you compare psychiatry to the rest of medicine using the same outcome metrics. In fact, this perspective often overlooks the complex nature of chronic illnesses across all medical fields, where a cure is rarely the primary goal. We need to evaluate success through a consistent lens, acknowledging that many conditions require ongoing management rather than a one-time fix. This comparison reveals that psychiatry operates within the same medical reality as other specialties, focusing on long-term health and functional improvement. In medicine, most chronic illnesses are not cured, they're controlled. We judge success by remission, stability over time, prevention of relapse, and most importantly, improvement in quality of life and functioning. For instance, conditions like hypertension, diabetes, and asthma are managed, not eradicated. The aim is to keep symptoms at bay, prevent complications, and ensure patients can lead full, productive lives. This approach is standard across approximately 80 to 90% of adult medicine, where chronic conditions affect a significant portion of the population, such as the 60% of U.S. adults living with chronic conditions, according to the CDC in 2023. Psychiatry operates in that same medical reality, focusing on reducing symptoms, preventing progression, and keeping people functioning, just like other chronic disease specialties. Consider hypertension, where the goal is rarely a cure, but rather controlling blood pressure to below 130 over 80 millimeters of mercury, a target achieved by only 48% of U.S. adults, as per NHANES 2017 to 2020 data. Similarly, in type 2 diabetes, only 53% of treated patients achieve an A1C below 7%, and while 40% might achieve short-term remission, 50 to 70% relapse within 5 years. Psychiatry's approach to managing conditions like major depressive disorder or bipolar disorder mirrors these long-term management strategies, aiming for sustained well-being and functional recovery. So, no, psychiatry is not a low-success specialty. It's a high-impact chronic disease specialty focused on remission, relapse prevention, and restoring human function. Our success is measured by meaningful improvements in patients' lives, such as the 60 to 80% employment recovery rates seen in treated serious mental illness compared to 20 to 40% in untreated cases, as highlighted by the NIMHRAISE study. This demonstrates psychiatry's profound ability to change lives at the level of identity, behavior, and suffering, making it a critical and effective component of modern medicine. Point. This message is for my non-psychiatric colleagues, particularly those who encounter patients in the emergency department, and for anyone who passes people on the street and forms an immediate judgment. In emergency settings, patients who arrive disheveled, malodorous, agitated, intoxicated, or asking for help are often quickly labeled. Once that label is applied, the person behind it can disappear. What is frequently missed is that these individuals are not what they appear to be. They are people at the very end of a long process of loss. Loss of health, stability, family, work, dignity, and often hope. Psychiatry does not operate at the beginning of illness. We often step in when every other system has already failed, when social supports collapse, when medical conditions go untreated, when trauma accumulates, when addiction, poverty, and mental illness converge. By the time many of these patients reach us, they have lost nearly everything. This is not a defensive message. It is an invitation to pause, to reflect, and to widen perspective. Psychiatry is not about excuses or moral weakness. It is about caring for human beings when their lives have unraveled in ways most people never see. The stigma surrounding mental illness and psychiatric patients has existed for more than a century, and it continues to influence how patients are treated, often unconsciously, across all areas of medicine and society. I ask my colleagues and anyone listening to open both mind and heart. The person you see in front of you is not their presentation in that moment. They are the sum of years of illness, adversity, and unmet needs. If we change how we see them, we change how we care for them, and that change matters more than we realize.